One of the biggest things to happen to plastic surgery in the last decade didn't come from a surgeon, it came from a pharmacy. I run a surgical practice and a medical weight loss program side by side, and post-weight loss bodywork has become the fastest growing thing in my practice almost overnight. In this video, I'm showing you what actually is changing in plastic surgery because of these drugs, and the thing that's happening to people's faces that almost nobody expects, and what to do right now so you come out the other side looking the way you want. Most people assume the biggest changes in plastic surgery come from new machines, new lasers, or some fancy new surgical technique a doctor invented. And that makes sense, because for decades, that's exactly how the field moved forward. Better tools, better implants, better lifts. The story was always about what surgeons could do with their hands. And the single biggest force changing my field today didn't come out of an operating room at all. It came out of a pharmacy, and it's already created a whole new kind of patient with a whole new set of problems almost overnight. The thing reshaping plastic surgery this decade is a shot originally designed for blood sugar and diabetes, not anything a surgeon dreamed up. And the way that shot is changing things isn't what you'd guessed. A class of weight loss medications, the GLP-1 drugs, known as Ozempic, Mounjaro, Zepbound, are moving so many people through so much weight loss so fast that it's filling my schedule with consequences the old playbook never had to handle at this scale. When a new highway opens near a town, nobody changes a single house, but suddenly everything reroutes around it, and the old main street empties out. New businesses pop up where the traffic now flows. That's what one drug did to my field. The procedures didn't change first, the flow of people did, and everything else is rearranging to catch up. For you, that means the most important decision about your transformation might not be which surgery you pick. It might be how you handle the medication and what you do about everything it leaves in its wake. The very first thing it leaves behind shows up in a place often people don't expect. When people picture losing weight, they picture it leaving the belly or the back or the thighs, the spots they actually want gone. And they assume the face just gets a little leaner and a little better looking. That belief spread because slow, steady weight loss usually does flatter the face, and because every before and after photo we grew up on sold us that idea: smaller body, sharper jaw, younger look. But fat weight loss doesn't read the script, and when pounds come off quickly, the cushion of fat that sits under the skin of your face can drain out. And what's left behind is hollow cheeks, deeper folds, skin that suddenly looks loose and older than the rest of you. You can lose the weight you wanted and walk away with a face that looks 10 years older than it did before. And the part that trips people up most, this isn't fixed by losing more weight, by working harder. The body lost volume it actually needed in your face. So the answer is about restoring and supporting what drained out, not chasing the scale further down. A grape didn't turn into a raisin because it got a disease, and the raisin isn't lazy. It just lost the volume that kept it plump. And once that volume's gone, the surface wrinkles make it fold on itself. A face that deflates too fast does the same thing. It isn't damaged, it's just emptied. And emptied skin behaves nothing like full skin. So for you, that means watching for it early matters. The face changes can show up even with fairly modest weight loss, long before you'd ever think about surgery, and there's some of the most treatable consequences if you catch them in time. But before any of that, you've got to figure out whether the way you're losing weight is setting up a much bigger problem under the surface. If this is already making you see this whole movement differently, do me a favor and hit subscribe. I'm putting out straight, no-spin breakdowns of what's actually happening in my field as it happens, and I'd like you here for the rest of it. So think back to how you actually got the medication. Maybe your friend gave you a name, you filled out a quick form on a website, script showed up. Now you're giving yourself the shot every week, nobody really checking on you. The number on the scale keeps dropping and it feels like a win every single morning. I see the same pattern over and over. When the medication comes with no monitoring, no real food plan, no plan to protect your muscle, and the weight comes off fast, but a big share of what you're losing isn't fat you wanted to lose. Did you get this medication online or from someone without regular check-ins, blood work, body scans? Has anyone actually told you how much protein to eat or built you a resistance training plan while you're losing? Are you watching the scale number and nothing else with no idea whether you're losing fat or losing muscle? If you answered yes to those, you're not doing anything shameful, but you're flying blind through the most important window you have. The way you lose weight right now decides what your body and your health look like long after the weight is gone, and you deserve to know what's really coming off. And that brings us to the part of all this that matters most, the thing that decides whether you come out of this stronger or worse off than you started. When people lose weight the unmonitored way, As much as half of what they lose can come from muscle instead of fat. And that wrecks two things at once. It wrecks the surgical canvas because loose, deflated tissue over lost muscle is far harder to work with, and it wrecks your long-term health because muscle mass and strength are among the strongest predictors of how long and how well you live. Losing weight but ending up frail isn't a win. What's coming and what already works is practices set up for it, and medicine and surgery and non-surgical care moving together so the weight you lose is fat and not muscle. And so every consequence gets handled across your whole body and face in a planned order. In my program, that means monthly check-ins with body scans that track whether your lean muscle, surface fat, and deeper fat around your organs are all moving in the right way, plus a slow taper instead of a hard stop. And one more piece of this shift. Judging someone for taking these drugs is outdated in my position. Nobody blinks when a person takes medication for blood pressure, depression, cholesterol, yet the person who takes a GLP-1 med and gets off those other medications somehow gets called a cheater. That's backwards, and the field is leaving that judgment behind. Emptying a moving truck in a rush, you'll toss the lamp and the dishes out with the trash as you grabbed whatever was closest to the door, and you only find out what you lost once it's gone. Losing weight with no monitoring works the same way. Your body grabs whatever is easiest to burn, and a huge chunk of that is muscle that you needed. Slowing down and looking at what you're actually unloading is the entire difference between a clean move and a pile of regret on the sidewalk. So stop treating the scale number as the only score that counts. A smaller number that came half from muscle is setting you up for a rebound in a frailer body, not a better one. Start tracking what you're actually losing. Get on a monitored plan with body composition scans so you know your lean mass is holding while the fat comes off, and feed and train that muscle while you still have the chance to keep it. So let me give you the simplest version of what to do tonight to get on the right side of all of this. The whole game here comes down to one thing. The medication shrinks you, but it doesn't decide what you shrink. Your protein and your training decide whether the body keeps its muscle while the fat leaves, and your monitoring decides whether you even know which one is happening. Fix those inputs, and you fix the root of almost every outcome that people are walking into. Do this, and you give yourself the best shot at coming out the other side leaner, stronger, and with a face and a body that still look like you instead of a smaller but hollowed out and worse for it. So here's the short list you can act on before you go to bed tonight. Write down protein target of roughly 1 gram per pound of your lean body weight and plan tomorrow's meals to hit it. Put 2 or 3 resistance training sessions on your calendar this week, even short ones with bands or body weights so your muscle has a reason to stick around. And if you're getting the medication with no real oversight, message a clinic that offers monitoring and body composition scans and ask about getting checked. Make a simple 2-column list, what the scale is doing and what you're doing to protect muscle and plan for the changes ahead. If the second column's empty, you're going to suffer. So the drug is the easy half, the half that happens to you. The half that decides how you look and how healthy you are on the other side is the half you actually steer, and the people who understand that right now are the ones who will look back on this era glad they did it on their terms. And if the weight has already come off and you're staring at loose skin, wondering what actually fixes it, I'm not going to cram that into this video because there's already a video on this channel that walks through exactly what works and what doesn't. It's called Loose Skin After Weight Loss. A plastic surgeon explains what actually works, and it's linked right here. Go watch that one next.